This is Uhuru's News. Senate queries federal government's plan to borrow $200 million for mosquito nets. The Federal Ministry of Health says it is planning to secure a loan of $200 million to procure mosquito nets to prevent malaria in 13 of the 36 states. The Senate has frowned at a plan by the federal government to borrow $200 million to purchase mosquito nets and other ancillary medical therapies to prevent malaria. Members of the Senate Committee on Local and Foreign Debts faulted the proposed loan requests when the permanent secretary of the Ministry of Health, Mahmuda Mamman, informed them of the plan. Mr. Mamman told the panel that part of the federal government's plan for the loan is to secure a $200 million facility to procure mosquito nets to prevent malaria in 13 of the 36 states. This, he said, is due to high rate of under 5 mortality in Nigeria, largely caused by malaria and inaccessibility to malaria treatments by residents in 13 vulnerable states in the country. Hence, the necessity of the loan. If approved by the National Assembly and accessed, the loan would be used to medically fight malaria in the 13 orphan states, which cover 208 local government councils and 3,536 primary healthcare centers, he said. But a member of the committee, Ibrahim Alarieg, APC, Kwara, wondered why plans were being made to borrow $200 million when 450 million naira had been budgeted for malaria treatment in the proposed 2022 appropriation bill. Mr. Alarieg, who is also the chairman of the Committee on Health, also wondered why there are no plans to produce and patronize mosquito nets and malaria drugs in Nigeria. This is unacceptable. We should be able to put our feet down when dealing with these donor agencies or creditors as regards loans to be taken, and what it should be expended on. This is a clear case of money and jobs for the boys by creditors luring you for loans and railroading you on what it should be spent on. Washington or whatever creditor offering the loan should stop giving us money with one hand and taking it back with another hand through railroaded spending, he said. Other members of the committee, including Senators Adalir Orialawo and Abba Moro, also faulted the ministry's proposal, describing it as frivolous. The lawmakers said the 450 million naira already budgeted for fighting malaria in the reported vulnerable areas was enough. When asked how the idea was arrived at and how it would be implemented, Mr. Mamman said a subsidiary arrangement had been made with all the states involved through the signing of the required agreement. On his part, the executive director, National Primary Health Care Development Agency, NPHCDA, Faisal Shuaib, further explained that the $200 million was for importation and local production of mosquito nets. The committee, thereafter, demanded to see the total needs of the agency to ascertain if there was a need for borrowing. They also demanded all documents related to the $200 million loan from World Bank for malaria medicine and mosquito nets. Please watch the video.
The citizens of Nigeria, I'm scared about them wanting to give us money. Because sometimes it's what we can do, but because they have money to borrow, they will come and say, oh, we know we have challenges in the sector, our indices, but it doesn't mean that we must borrow money to address it. We can look, as the chairman said, particularly since this president came, in the last 2 years, the health sector has gotten increased and improved budgetary allocation. So let's be looking at what do we use that budget for first, before we go external.
Responses and all that. You are coming back to say you want money for want loan. I mean to do. We don't know what you want to use the money for. Yeah, do you have a program for malaria vaccine in this country?
No, the malaria vaccine is not that one is not yet in the board. It's just coming up. The vaccine is different.
Yes, Mr. Chairman, I respectfully.
I think, as a rider to what has been said, it is necessary for you to picture for us your total need, so that if our domestic resources is not enough, we will know the gap. We will know the difference, and we will know. It's not that you ask for 200 or 450 million and you are given, and you are appropriated for, and again you are asking for money that you want to complement that one. Let us know the global need, so that when we know that whatever is given from you to you domestically, we will know before you can go to borrow from external donors.
That we're asking for as part of the World Bank loan are resources that we require to augment domestic resources that are provided for in the budget. What we're getting in the budget is grossly inadequate for us to reach the large population of Nigerians. And as a matter of fact, if we do not get this loan, we are not able to procure adequate vaccines to reach our children. This is why there are, huge concerns.
We should, as a country, be able to put our foot down. Yeah. What we use for our people should be what we produce. Not if somebody wants to give us money and also put conditions that you must buy from their manufacturer, we can say no for our certainty. If there are manufacturers in Nigeria, we are not selling this, our own net, our own drugs to Ghana or to anywhere. We are using it for Nigerians. So that should be part of what should be in any this we want to take. Yes. Just like I told MPCD, I think we need a detailed listings of what this money, all this while you are saying procure net and so on, this 13 stating. It's just an analysis by somebody in Washington to say, oh, this is your gap and then you need this money. We need more further details to approve. Because when we talk about intervention in health sectors, we want interventions that Nigeria will be able to see that it is making impact. Not Washington giving us money in one right hand and taking it back with the left hand under the guise of buying.